and assisted living facilities. But because we had the 11 cases, we now have 11 cases in Broward County. I'm directing Jared Moskowitz to expand the current order and prohibit all visitation to nursing homes, assisted living facilities, adult family care homes, long-term care facilities, and adult group homes in Broward County for the next 30 days. Beyond that order, I've directed the Secretary of our Agency for Healthcare Administration, Secretary Mayhew, to aggressively and continuously connect with all these facilities throughout the state, in person, by phone, whatever you need to do, to ensure that they're following appropriate protocols and have a plan in place should they have an individual that tests positive. So far, Secretary Mayhew and her team have visited over 260 facilities in person. So we appreciate with that. As I said yesterday, we're committed to expanding testing capabilities in the state of Florida. We all know that there was CDC tests and everything. I wanted to make sure Florida was acting quickly on its own to do this. So I directed Director Moskowitz to purchase 2,500 testing kits that will give qualified labs throughout the state the capacity to process tests for up to 625,000 individuals. Each kit allows 500 tests, but you need 2 tests per person. So you're looking at 250 individuals per kit. Up to that amount, obviously, the tests have to be done. Department of Health at the 3 labs operating in Tampa, Jacksonville, and Miami can do a combined 300 patients per day of samples. We also have the capacity to do another 100 tests per day with a CLIA-certified labs throughout the state. The goal is to have 50 of these CLIA-certified labs throughout the state, processing about 100 per day. So that would be a good increase in our capacity should that be necessary. You also have the private sector that is stepping up efforts, Quest and LabCorp. Now, they don't actually take the samples for the test, but they process the test and come up with results. And so those are collected, shipped out every night. They test all through the night, and they're trying to get the results back within a 24-hour period. I think by the end of next week, both companies are going to be doing about 20,000 samples a day nationwide. Now, obviously, Florida will be a part of that. And so that is something that will be beneficial as well. I want to stress, if you're somebody who is experiencing symptoms of COVID-19, fever, cough, shortness of breath, and you speak to a physician and they think that you should be tested for it, then we have opportunities to do that via the Department of Significant Symptoms. Again, those are going to be younger populations and healthier populations. But I think this is a good effort to, as this thing goes more, I mean, we knew we were going to have more cases this week. There's going to be more cases next week. I mean, that's what's happening. I think some of the social distancing that's being done with reducing the gatherings, some of the other things that have been implemented in nursing homes, I think that's all important. I think that'll help. But just from the contacts based on the cases so far, you're anticipating more. So we want to make sure we have the increased testing capacity, and we didn't want to wait for anyone else to do it. Incidentally, when we spoke to the manufacturer of the test kits, they told us Florida's purchased more than not only any other state, but all the other states combined. So I really appreciate Director Moskowitz getting on that issue and getting these things out. I'm also announcing today that we will be, in probably over the next 24 hours, activating certain components of the Florida National Guard to assist in our efforts to support our local communities that are affected by COVID-19. We're working on the shape and scope of that. If you mobilize a physician who's actually working on this now in their community, .gov, it's got the updated guidance on COVID-19, and I want to thank the Surgeon General. I don't think he's rested very much over the last however many weeks and months, and we appreciate his help. So I'm going to let him say a few words, and then I'm happy to take some questions.
Thank you, Governor. Good afternoon, everybody. First, I want to begin by thanking the Governor, Lieutenant Governor, for their incredible support and guidance in this response, and also fellow agency directors. This is a massive response that is involving thousands of individuals. Again, COVID-19, this is a new virus that has recently appeared. The spread is person to person, which is why we have precautions in terms of covering your cough and some of the other measures we talked about. This is like the flu, but is slightly different than flu in terms of symptoms. The most common symptom is fever followed by a dry cough and then associated with fatigue. As the governor mentioned, most of the cases that we are seeing in Florida are related to travel internationally or to areas in the United States where we are currently having outbreaks. This is why it is very important that if you come to Florida from an international destination, tremendous capabilities, and we encourage hospitals that are CLIA certified, that have capabilities for molecular diagnostics to participate in this. Also, in terms of medical providers, we have given medical providers information and we'll be writing more about this. So in terms of what can we all do? COVID-19, as the governor mentioned, is being seen in many states across the country, and we need to protect ourselves for the eventuality that the number of cases will continue to rise. Practice social distancing. Avoid going to work when you're sick. If you're coughing, cover your cough. In terms of hospitals, again, wish to emphasize that hospitals continue to review their infection control practices, make sure that your workforce is protected as we're dealing with individuals who will have COVID-19. In terms of what our goals are, first, we are working to contain the spread of the virus. So if we have identified individuals who have COVID-19, we will identify the contacts of these individuals, and so these individuals will be asked to self-isolate. This way we can break the spread and chain of transmission. And I really want to acknowledge the incredible activities of the members of the Department of Health, particularly the epidemiologist.
I do not want to be somebody who is put out as governor for that. So we've been taking some of those measures, and that's just the way it's going to be. And so, but we were told, no risk on this given the circumstances. And I know they're looking at Mayor Jimenez, but there's nothing that would suggest that he's positive at this time. Nope. So a lot of these labs do have some. We also were able to, Jared Moskowitz was able to procure an order. So we're going to have a lot coming in, and they're scheduled to be here in 2 weeks. But we think that given where, some of the existing supplies in the labs, that the test kits that we're sending will be useful. But clearly, if you get a real spike, we wanted to make sure that we had more of the ability to collect the sample. And that doesn't have that. This is just the testing kit, not the part for the sample. I didn't see what he said. I mean, what the Department of Health is doing, I told them, is as this information comes in, as soon as you know how. We're definitely voting. I mean, this is they voted during the Civil War. We're going to vote. I've just stressed to Secretary Lee, and she has stressed this with the local supervisors, is we need to be erring on the side of safety. I don't want people going into these assisted living facilities if you're not part of that community. It's just not worth the risk. That may mean some voters get inconvenienced who aren't part of those communities. But to me, it's a no-brainer to err on the side of the safety of our residents. This is, these primaries, the way this has worked out, I mean, quite frankly, are not going to be cliffhangers. And so I want to err on the side of protecting those folks. But that's ultimately going to be decisions that the local supervisors are going to have to make. I think most of them understand that this is something that they should be doing. Okay, one more. I'll let Scott address that. I think that, I'll let Scott address that when there may be a need for that. Obviously, if we have the Guard involved, that expands our capabilities on some of those things. But
yeah, thank you. First, when we have situations where, first, I want to emphasize the fact that we are rapidly increasing testing capabilities, and we'll emphasize. It's
very labor intensive, takes a lot of work, but obviously you need to have the individuals identified as being positive before you can do it. Thanks. We'll have more updates later.